Greetings, fellow learners and healthcare enthusiasts of Wally's Nursing Videos. Today, we're embarking on a captivating journey that will lead us through the intricacies of the cardiovascular system. We're about to delve into the heart of drugs affecting the cardiovascular system. Picture this: the steady rhythm of a beating heart, the intricate dance of blood vessels, and the delicate balance that maintains our cardiovascular health. Are you ready to explore this dynamic realm? Let's set forth on an educational adventure together. In this remarkable section, we're immersing ourselves in the world of medications that influence the cardiovascular system. From controlling blood pressure to managing heart rhythm irregularities, we're about to unlock the mysteries behind these life-changing pharmaceuticals. As we embark on this journey, get ready to dive deep into Chapter 26, where we'll uncover the intricate landscape of drug therapy for hypertension. We'll explore the mechanisms by which antihypertensive drugs like ACE inhibitors, beta blockers, and diuretics regulate blood pressure. But that's not all. We'll also navigate the potential side effects such as hypotension, cough, and electrolyte imbalances, while keeping contraindications like pregnancy and renal dysfunction in mind. Chapter 27 beckons us to unravel the complexities of drug therapy for dysrhythmias. We'll dissect antiarrhythmic agents like beta blockers, calcium channel blockers, and amiodarone, understanding how they restore heart rhythm. Dive into potential side effects including bradycardia and QT prolongation, while appreciating contraindications in patients with heart blocks or certain medications. Chapter 28 takes us into the realm of drug therapy for coronary heart disease. We'll explore anti-anginal drugs like nitrates and beta blockers, appreciating their mechanisms of vasodilation and heart rate control. While we navigate through side effects such as headaches and dizziness, we'll also consider contraindications including hypotension and use of erectile dysfunction medications. Chapter 29 brings us to the critical domain of drug therapy for shock and hypotension. Vasopressors like norepinephrine and inotropes like dobutamine take center stage. We'll uncover how they support blood pressure and cardiac output, all while scrutinizing potential side effects such as arrhythmias and peripheral vasoconstriction, along with contraindications including certain heart conditions. Finally, brace yourself for Chapter 30, which delves deep into drug therapy for heart failure. We'll navigate through ACE inhibitors, angiotensin receptor blockers, ARBs, and beta blockers that enhance cardiac function. As we discuss side effects like hypotension and dry cough, we'll also take into account contraindications like pregnancy and severe renal impairment. So, fellow learners, are you ready to journey through the cardiovascular labyrinth? Don't forget to hit that subscribe button and tap the notification bell because we're about to embark on a transformative learning adventure. Welcome to Wally's Nursing Videos, where knowledge meets passion, and healthcare comes alive. Let's dive right into the heart of the matter. Drug therapy for hypertension. In the intricate landscape of hypertension management, we encounter an array of medications that skillfully lower blood pressure and mitigate cardiovascular risks. As we navigate the world of antihypertensive drugs, we uncover their mechanisms, potential side effects, and contraindications. Mechanisms of action. Antihypertensive drugs target various mechanisms to achieve blood pressure control. Angiotensin-converting enzyme, ACE, inhibitors, such as lisinopril, block the conversion of angiotensin I to angiotensin II, promoting vasodilation and reducing fluid retention. Beta blockers, like metoprolol, slow the heart rate and reduce cardiac output. Diuretics, such as hydrochlorothiazide, enhance sodium and water excretion, reducing plasma volume and blood pressure. Side effects. While these agents are essential for blood pressure management, they come with potential side effects. ACE inhibitors can cause a persistent cough, elevated potassium levels, hyperkalemia, and angioedema. Beta blockers might lead to bradycardia, fatigue, and bronchospasms in patients with respiratory conditions. Diuretics can trigger electrolyte imbalances, hypotension, and renal dysfunction. Contraindications. Contraindications guide treatment decisions. ACE inhibitors are contraindicated in patients with a history of angioedema, pregnancy, or bilateral renal artery stenosis. Beta blockers should be avoided in patients with severe bradycardia, heart block, or asthma. Diuretics should be used cautiously in patients with renal impairment and electrolyte imbalances. By comprehending these mechanisms, potential side effects, and contraindications, healthcare professionals can make informed decisions that optimize blood pressure management and enhance patient outcomes. Drug therapy for dysrhythmias. Navigating the intricate landscape of dysrhythmias demands a deep understanding of antiarrhythmic agents that restore normal heart rhythm. As we journey through this chapter, we'll delve into the mechanisms, potential side effects, and contraindications of these medications. Mechanisms of action. Antiarrhythmic drugs target the electrical impulses of the heart to restore rhythm. Beta blockers, like propranolol, inhibit the effects of adrenaline, reducing heart rate and contractility. Calcium channel blockers, such as verapamil, slow conduction through the heart's electrical system. Amiodarone, a potent antiarrhythmic, acts on multiple ion channels to stabilize rhythm. Side effects. While antiarrhythmic drugs can be life-changing, they're not without potential side effects. Beta blockers might lead to bradycardia, hypotension, and fatigue. Calcium channel blockers can cause constipation, dizziness, and edema. Amiodarone, despite its efficacy, has the potential for thyroid dysfunction, pulmonary toxicity, and corneal deposits. Contraindications. Contraindications guide the choice of antiarrhythmic therapy. Beta blockers should be used cautiously in patients with severe bradycardia and asthma. Calcium channel blockers are contraindicated in patients with heart blocks and systolic heart failure. Amiodarone should be avoided in patients with iodine allergies and severe sinus node dysfunction. Understanding these mechanisms, potential side effects, and contraindications empowers healthcare professionals to tailor antiarrhythmic therapy for optimal patient outcomes. Drug therapy for coronary heart disease. In the realm of coronary heart disease, a spectrum of medications plays a crucial role in managing angina and improving myocardial oxygen supply. Let's delve into the mechanisms, potential side effects, and contraindications of these medications to navigate this territory effectively. Mechanisms of action. Anti-anginal drugs target different pathways to alleviate chest pain and enhance blood flow to the heart. Nitrates, like nitroglycerin, induce vasodilation in coronary arteries, reducing preload and afterload. Beta blockers, such as metoprolol, lower heart rate and contractility, thereby reducing oxygen demand. Calcium channel blockers, like diltiazem, relax coronary smooth muscles and dilate arteries, enhancing blood flow. Side effects. While these medications alleviate angina symptoms, they aren't without potential side effects. Nitrates may lead to headaches, hypotension, and reflex tachycardia. Beta blockers can cause bradycardia, bronchospasms, and fatigue. Calcium channel blockers might result in constipation, dizziness, and peripheral edema. Contraindications. Contraindications guide the choice of therapy. Nitrates should be avoided in patients with severe hypotension and concomitant use of phosphodiesterase inhibitors. Beta blockers are contraindicated in patients with severe bradycardia, heart blocks, and asthma. Calcium channel blockers should be used cautiously in patients with heart failure and certain arrhythmias. By comprehending these mechanisms, potential side effects, and contraindications, healthcare professionals can tailor therapy to optimize coronary heart disease management and enhance patient quality of life. Drug therapy for shock and hypotension. The realm of shock and hypotension calls for a keen understanding of vasopressors and inotropes that stabilize blood pressure and cardiac output. As we explore this critical domain, we'll uncover the mechanisms, potential side effects, and contraindications of these medications. Mechanisms of action. Vasopressors and inotropes target different pathways to elevate blood pressure and improve cardiac function. Norepinephrine, a vasopressor, constricts blood vessels to increase peripheral resistance and elevate blood pressure. Dobutamine, an inotrope, enhances cardiac contractility, improving cardiac output. Side effects. These medications are essential in critical situations, but they come with potential side effects. Norepinephrine may lead to arrhythmias, peripheral vasoconstriction, and tissue necrosis if extravasation occurs. Dobutamine can provoke tachycardia, hypotension, and arrhythmias. Contraindications. Contraindications play a pivotal role in treatment decisions. Norepinephrine should be avoided in patients with hypovolemia and severe tachycardia. Dobutamine is contraindicated in patients with hypertrophic obstructive cardiomyopathy and idiopathic hypertrophic subaortic stenosis. Understanding these mechanisms, potential side effects, and contraindications empowers healthcare professionals to make informed choices in managing shock and hypotension, ultimately improving patient outcomes. Drug therapy for heart failure. Welcome to the realm of heart failure management, where a range of medications plays a pivotal role in improving cardiac function and alleviating symptoms. Let's delve into the mechanisms, potential side effects, and contraindications of these medications to navigate this terrain effectively. Mechanisms of action. Medications for heart failure aim to enhance cardiac performance and alleviate symptoms. Angiotensin-converting enzyme, ACE, inhibitors, like enalapril, dilate blood vessels and reduce fluid retention, easing the workload on the heart. Angiotensin receptor blockers, ARBs, such as losartan, have a similar effect. Beta blockers, like carvedilol, lower heart rate and reduce cardiac workload. Diuretics, such as furosemide, help eliminate excess fluid and sodium. Side effects. While these medications improve heart failure management, they're not without potential side effects. ACE inhibitors and ARBs can cause hypotension, hyperkalemia, and renal dysfunction. Beta blockers might lead to bradycardia, hypotension, and bronchospasms. Diuretics can result in electrolyte imbalances, hypotension, and renal dysfunction. Contraindications. Contraindications guide treatment decisions for heart failure. ACE inhibitors and ARBs should be used cautiously in patients with severe renal impairment and bilateral renal artery stenosis. Beta blockers are contraindicated in patients with severe bradycardia, heart block, and asthma. Diuretics should be used carefully in patients with electrolyte imbalances and renal dysfunction. By understanding these mechanisms, potential side effects, and contraindications, healthcare professionals can tailor therapy to optimize heart failure management, enhance patient quality of life, and improve overall outcomes. As we journey through the intricacies of drugs affecting the cardiovascular system, keep in mind that each medication is a tool in the hands of skilled healthcare providers, shaping the way we care for patients and contribute to their well-being. Stay tuned for more insights as we continue our exploration in the captivating world of healthcare. Let's continue this educational adventure together. As we conclude our journey through the realm of drugs affecting the cardiovascular system, let's highlight some commonly used medications in each chapter and offer a quick tip on how to identify them easily. These medications are powerful tools in the hands of healthcare professionals, working to enhance patient well-being and cardiovascular health. Drug therapy for hypertension. Commonly used drugs: lisinopril, ACE inhibitor; metoprolol, beta blocker; hydrochlorothiazide, diuretic. Identification tip: ACE inhibitors often end in pril, beta blockers often end in olol, and diuretics like hydrochlorothiazide have a thiazide in their name. Drug therapy for dysrhythmias. Commonly used drugs: propranolol, beta blocker; verapamil, calcium channel blocker; amiodarone, antiarrhythmic. Identification tip: beta blockers often end in olol. Calcium channel blockers usually end in pamil. And antiarrhythmic agents like amiodarone often have unique, longer names. Drug therapy for coronary heart disease. Commonly used drugs: nitroglycerin, nitrate, metoprolol, beta blocker; diltiazem, calcium channel blocker. Identification tip: nitrates often have nitro in their name. Beta blockers usually end in olol. And calcium channel blockers like diltiazem often end in zem. Drug therapy for shock and hypotension. Commonly used drugs: norepinephrine, vasopressor; dobutamine, inotrope. Identification tip: vasopressors like norepinephrine often end in epinephrine, and inotropes like dobutamine have a distinct, unique name. Drug therapy for heart failure. Commonly used drugs: enalapril, ACE inhibitor; carvedilol, beta blocker; furosemide, diuretic. Identification tip: ACE inhibitors often end in pril, beta blockers often end in olol, and diuretics like furosemide are often recognized by their "ide" ending. As you encounter these medications in practice or study, remember these identification tips to quickly grasp their therapeutic category. Understanding these drugs, their mechanisms, side effects, and contraindications empowers you to provide effective patient care and contribute to their cardiovascular health. Thank you for joining us on this enlightening journey through Wally's nursing videos. We're here to support your educational endeavors, so don't forget to hit that subscribe button and stay tuned for more insights that fuel your passion for nursing and healthcare. Until next time, keep learning and caring for others with the expertise that sets you apart. Remember to subscribe and hit that notification bell so you don't miss out on any of the enlightening content we have in store for you. Happy studying!